My name is Mary Charlton, and I'm a cancer researcher at the University of Iowa. I also help run the Iowa Cancer Registry, which tracks all cases of cancer diagnosed among Iowans. I focus mostly on colorectal cancer research, as Iowa has one of the highest rates in the country. Specifically, I focus on rectal cancer, which is actually quite different from colon cancer once it's diagnosed. It's far rarer and much more challenging to treat. But my research shows that most people don't know that. In fact, many Iowans see surgeons for their rectal cancer who really don't see very many patients with rectal cancer per year versus specialized surgeons who treat a lot. And this can have a big impact on outcomes. My research focuses on helping people make informed treatment choices, get second opinions, and live longer lives with the best quality of life possible. While we can't prevent all cancer deaths, we'd certainly rather have people die from cancer at age 100 rather than age 50.